So I wanted to give you a quick background in terms of why we chose this particular panel to feature at this institute. Law enforcement, role of law enforcement within substance use prevention is widely varied. And ADAPT has recently begun a journey in characterizing, the different ways in which law enforcement is engaging in prevention in their community, whether it's within a school setting, whether it's with other organizations, whether it's independently on the streets with the youth. We just don't know all of the different ways that they are engaging. And so we're starting that journey. We're trying to characterize that a little bit, understand it better, and bring that to life for everyone. That said, there are some things that have happened. There are some things that we do know. Recently, the United Nations has published its first document on the role of law enforcement prevention in schools. So there's a starting point for understanding that, right? And what other countries are doing, including the United States. There also are a lot of fundamental ways thinking about this and all of the possibilities. So the purpose of today's panel is not just to focus on the role of law enforcement within substance use prevention, but also what that looks like when it intersects with public health, what those partnerships look like, where the opportunities currently exist and are being implemented, but also where they are moving forward, generating ideas for maybe how we can think innovatively as well with this public health, public safety space that we have started to characterize already. So I want to thank our panelists. I'm going to ground all of us in our main messages for our institute, which is what are we really trying to achieve in anything that we touch? What are we trying to achieve in the work we're doing? And that's effective prevention. Effective prevention requires a comprehensive strategy. Operationalizing that strategy is hard work. And doing the hard work requires collaboration. And we're going to touch on a lot of that today. But effective prevention will yield, we will see and tangibly understand the results of what we're trying to achieve, where we're headed, our destination. So with that, what we thought we'd do is we'd ask Silly, who is the president, director, everything leadership wise of Applied Prevention Science International. She's been doing this a long time. And she has a framework, a way of thinking about this that she's going to set the stage for us with today. So I'd like to invite you up, Zoe, to share that information with us.
Thank you, Chelsea. Thank you, Laura, for the introduction. And I guess thanks for that. I wanted to thank them for what they're doing, the courage. You imagine the courage to stand up and to do all the work they've done to present that over and over again. I mean, I just can't even embrace that. But I think they set the stage for what we're all about, what we're trying to achieve. And also, it's not just a US problem, it is an international problem. I'm really happy that we focus on that too. And Laura presented some international data. There's some also recent report out that looked at internationally at two data elements. One is looking at the potency of THC around the variety of countries, and then the perceptions that children have, particularly early adolescence, about the harm, the risk associated. And you can imagine it's an inverse relationship. So it is something that is timely and really of concern to us today. I also just want to apologize. This is the first time I'm presenting in person in a long time. And I am a little nervous about it. I don't have the barrier in front of me. So I am trying to stick to my notes here. But it's my pleasure to be here today and to meet all of you. Hopefully we'll be a little bit more over the next day or so. And I wanted to thank Laura for everything. Laura has become is an amazing human being, and we really appreciate her in the prevention area. And I also want to thank my panel. because they bring this down to reality. So I'm going to be talking sort of up here. Hopefully you'll make some connections along the way from your own personal experiences. I'll just move on. Okay, so what I want to do, what I decided to do is to start off with looking at vulnerability. I think the presentation earlier sort of really reinforces that. Understanding vulnerability to not only substance use, but other problem behaviors is really foundational to developing a comprehensive prevention service delivery system. And that's what we're sort of trying to achieve. When I talk about vulnerability, what does that mean? So I developed this, it looks complicated, but it's a simplification of processes that are associated with how we involve ourselves in either pro-social or problematic behavior. So what if I try to treat in this table, in this chart? So first of all, when we're born, we have our own biological and physiological characteristics. Many of you who have children, you have more than one child, you know, same gene pool, they just present themselves differently, they behave differently, they act differently, right? So we're all individuals in that response. And what happens is how do we become human beings in our society? And how we do that is shaped by our interactions with our environment. So the whole nature nurture paradigm, I think it really applies here, and it really is alive. So if we're in positive environments, we are able to achieve developmental goals. If we're in a negative environment, we're a little slowed down a bit. I often use my brother and myself as examples. My brother, he's not with us anymore, but he was a little bit more of a problem than I was. He had a different temperament than my parents. My parents did not know how to parent him, and he got into trouble as he, especially in his teenage years. But fortunately, he was fine. When just about 10 years ago, I asked him, he was in his 70s, and I said to him, do you think granddad should have raised you? Should mom and dad should just turn him over to him? And he said, you know what? I think about that a lot. If I was raised by our grandfather, my life would have been different, because my grandfather had the same temperament as my brother had. So parenting is really important, and we'll be talking more about that a little bit later. So the microenvironment, you can see that relationship. Our parents are, as we get older, when we go into school teachers, our peers. Think about workplace. Think about when you left school and you went to your first job. You met new people who had new experiences. They introduced you to new ideas, new beliefs. Changing jobs. I know I've changed a number of jobs. I've been in different universities, and each place has their own culture. Even sometimes how you dress. Look at us up here. I mean, the idea of putting a pair of high heels on. I really admire that. So, even the way we dress is really guided by our peers as well as our environment. So we have these influences, the microenvironment as well as the macro level environment that interact with us. We also give back, right, to those environments. As I said, my parents and my brother, they had that relationship that was a little bit difficult. So that happens. I actually have updated this slide recently, and I'm sorry I didn't include that, but we're talking about climate change is becoming a real issue in the field of prevention, because it impacts how we our lives in so many ways. Think about just think about a farmer and how climate change is. Look at the news. Look what's happening in Africa. Look what's happening around the world. Colombia. This is Colombia. They're having problems with growing coffee because of the climate change. That's changed their economy. So think about what impact that has on jobs, et cetera. So I'm going to put that back into this. And this interaction shapes our beliefs and our attitudes and how we behave. So this process is really fundamental to what we do in prevention. For many of you are probably familiar with the terms risk and protective factors, and we'll be getting into that a lot later, I believe, this afternoon perhaps. And I see the risk and protective factors are the interactions between these environments with themselves as well as with our individual characteristics. So if they're negative, if that interaction is negative, then there are going to be some problems, then you're at risk. And if they're positive, obviously we're going to be perfectly enhanced and we'll be doing well. And as a matter of fact, speaking about Carl Hill, Carl has done some wonderful research, and I just took this slide from one of his studies, which I think shows us this interaction. So these are, he looked at a population of children, he and his colleagues looked at a population of children with behavioral discrimination, such common behaviors, and how they fared years later. We follow them through the age of 27 to see about their relationships with alcohol and alcohol dependence. And you can see clearly here that those children, they had the same temperaments. Those that were raised in families where there was positive parenting, where there was good family management, fared better than those that did not. So this we see in reality. But if we step back and the line time is important. I mentioned that we go through these changes across the lifespan, right? So time is important and we transition. And this is an area that I'll talk about it, and I think many of you will have these aha moments, but has not been really fully addressed in prevention. And that is that, oops, sorry. I really speed it up, right? Now we go through life transitions, right? There are the physical changes, the normal developmental changes. From birth, we change physically, we change emotionally, we change cognitively. But and then there are environmental changes, we move. There's a nice chart that I often use by Dr. Shep Kellum, and it shows how these transitions over time, the different groups that influence us. So our parents are obviously have a big influence us early on. School takes on another role than our peers, et cetera, and in the workplace. Even though your parents, believe me, are always in your head, right? Until the end. But also there's social changes. So your roles change. So you have peer relationships. You start dating, it's marriage, it's having kids. Then your children grow up and they have kids, you have grandchildren, so it's wonderful. And then of course your work situation, they change jobs, may get promotions, you're taking on new roles. So we're always going through transitions. One thing I want to emphasize is the transition for kids between schools. So some places you go to an elementary school, and then you go to another school for middle school, then you go to another school for high school. Those transitions are very difficult for us. And COVID has really, really, really underscored how important those transitions are, particularly between middle school and high school. And the data are showing that kids that don't make it in the 9th grade aren't going to graduate from high school. So those transitions, we need to help kids transition over time. And I mentioned these types of transitions. This graphic also is helpful in that it points out where interventions can take place. So I indicate those with stars, the points of indication. So we have a school-based program. So that's between the micro level environment, the school and the individual, the child. But we also, that many know about that. We also have programs, evidence-based programs that help just directly with the child individually, particularly children who have problems, but we'll be talking more about primary prevention. And then, of course, there are interventions between the macro and the micro level that we can do, and we're talking about environmental strategies. So this slide, this graphic shows you that there are different types of interventions for these places. And what does that result in reality? So if you look at a community, I come from a middle-sized city in Ohio, and we have prevention things sort of all over the place in our town. We have things going on in the schools. We have a family and social services group, drug courts. We have the healthcare system. We have counseling. We have treatment services, etc. They're all over the place. And so even if you are in that community trying to track where are prevention activities, you may not find them. When I was early on doing these kinds of trainings, I would have people think about look up in the yellow pages, look up treatment, look up substance use treatment. The yellow pages, it's a listing of substance use treatment. You can do this with your GPS. Where's a drug abuse treatment program in this area? Look up prevention. I don't think you're going to find them. So it's sort of invisible, our prevention work. There are obviously prevention professionals who would say, I am a prevention professional. But there are many professionals out there, particularly in the health area, who are doing prevention work. But if you said to them, you're doing prevention work, they say, no, I'm doing health work. And that's where the interplay between public health and prevention, kinds of prevention work we're doing is really important. So we know these things are happening. The other thing is we're talking about behaviors that aren't just the problems of the school. They're not just problems of our faith-based institutions. They're not just problems of law enforcement. They're community problems. And so everybody has a stake in doing something about it. So the way we are finding, and we have good evidence to demonstrate that if you have built what I'm calling here a prevention implementation system, and that would be building an infrastructure. That would be a community partnership, community coalitions, they're known by different names. If you have that infrastructure in place, it identifies where prevention is happening. It makes people aware of those activities. And it's an opportunity to bring evidence-based interventions into your communities. And we'll be doing workshops today and tomorrow talking about how to do that effectively. So where does law enforcement fit in this picture? So I thought I'd be real academic here to start off with. And what is law enforcement? And I do this a lot for prevention professionals so that they understand what law enforcement should be and what their role is, and how does that fit then into what we're trying to do in prevention. So law enforcement, enforces laws and maintains public order and public safety. What does prevention do? This is a definition from the United Nations Office on Drugs and Crimes. It's kind of an international definition. We're still seeking to have a solid, well-embraced definition of prevention, but I think this comes close to what we're doing is based on a lot of the research that I presented earlier. So prevention also addresses health and safety, just like law enforcement. And it does this by improving those socialization processes that I talked about before in my diagram. And the end goal is to help self-realization, want people to be successful, to be contributing members of their society. And why I want to talk about science now. And science is really important for both law enforcement and prevention. And I want to underscore that. So law enforcement is informed by police science. It's probably not so overt to many of those in the law enforcement field that there is a science behind detecting, preventing, investigating, how to investigate a crime. You learn those behaviors, the science behind that. And prevention is informed by prevention science. And I was talking to Carl earlier, we're still trying to define prevention science. And there's a group, the Society of Prevention Research, that had put together a document in 2011 that started to define the field. And actually, we're working on it currently to update it. So prevention addresses determinants of behavior to protect or put at risk our environments as well as individuals. It specifies the processes as to how these operate. And this draws a lot on what we know about theories of human development, theories of behavior change. It helps to identify those pieces that are important to put in place. And it also determines the strategies that are effective. And I give a lot of kudos out to our methodologists, our statisticians, who were able to provide the tools that were necessary to look at not only short-term outcomes from prevention programs, but long-term outcomes. We have many that are looking at even children that were in the initial studies. So we're able to really know what really works, what are the factors. And these are theory-driven, mostly theory-driven interventions that we'll be talking more about. Later. So why is science important? I think that's clear. And so police science provides the answers to these key questions that you can look at here. And prevention science actually looks at who is affected by the behavior, who's vulnerable, getting to the vulnerability, what are the consequences of these behaviors? Because and we heard a lot this morning. Without that information about cannabis, we have something we can demonstrate to people to convince them with the science of the consequences of use of marijuana, and then how to effectively intervene. And then, of course, I put this together. This is a work in progress. If any of you have any suggestions for enhancing that, I would love to hear that. So I see that we have shared objectives and shared goals between law enforcement and prevention. And I think some of these were, again, were raised this morning because I think that what Laura was talking about was, why can't we have policies and regulations in place as we do for alcohol and tobacco? So we're regulating the, you buy a bottle of scotch, it has what percentage of alcohol is in it. It's all regulated. You know what that is. With tobacco, you're regulating all of that. We haven't put those things in place with marijuana, and many of us in the prevention field feel it's extremely important to put those policies in place. So we have policies on the ground in terms of who can access, about the availability and accessibility of alcohol and tobacco. And law enforcement has a huge role in that. How do you enforce? Enforcement, well-enforced those environmental strategies really lead to positive outcomes. We have very strong. In fact, there are some community coalitions that focus primarily on those, and they have a huge impact on access to alcohol and tobacco. Why can't we do that for marijuana? So the context in which these things are available is important. The other thing that I'm going to raise, but I think the hideouts have been really important. I've been working with a local hideout in Ohio, and they've been analyzing seized drugs. What are the content of seized drugs? And we know, as you know, that it varies. Obviously, fentanyl is important. We're seeing a lot of meth now. Just what was presented this morning, I think Laura was wonderful in laying that foundation. We're seeing that, of course, it varies from place to place, community to community. It varies what the content is. So prevention professionals really need to understand what that is, because prevention professionals often have to explain to parents, to school groups, to community groups, what's happening in the community in terms of drugs. So that's important. Also law enforcement is important in reinforcing non-use norms, and some of that's related to regulations, enforcing the regulations. So I see law enforcement as a very important role and very important place at the table in these community coalitions. I've worked with a lot of community coalitions. I do a lot of training of community coalitions, and their two biggest complaints: law enforcement isn't at the table, and faith-based organizations are. We talk a lot about how to engage them. So you have a really major role there. I won't go into all the details in establishing a prevention implementation system, but we need to obviously we have to have the services, have to be evidence-based. We need trained people. That's where I've devoted the rest of my career to training. That's why I established the Applied Prevention Science International. And at this moment, we're doing a big training in Utah with prevention professionals to build these structures, community implementation structures. So we're doing that. So there are a lot of items that we're going to be getting into more later in our work when we do our workshops in terms of how to build these systems. I want to underscore again the international nature of these problems. There are two major documents I think are worth having. One, Laura mentioned the role of law enforcement officers in drug use prevention. Laura, modest as she is, I had a role in that. She and I were on the group to help put those guidelines together. They just came out Monday. They were just released Monday. And then there's the United Nations International Standards on Drug Use Prevention. And that was completed to bring together all we know about evidence-based prevention. And it's a really wonderful document. It needs to be updated. There's not as much research being funded in this area as there have been in the past, but there's still room for adding more things here. And what's good about the way this is set up is that it's you can look at a specific age group and find out within a setting what are the evidence-based prevention programs. So for prenatal care, there are evidence-based prevention, how to handle and help with first-time mothers who are substance users, what we can do to help them. And the outcomes go to the kids into their teen years. We have programs for in schools, programs for parenting programs. So these are really good documents to have. And with that, I will please turn over the panel who have on the ground experiences.
Okay, thank you, Billy, for setting the stage for us. All right, so we are going to head straight over to Willie and start with the thing. And we want to get into your brains. And the first question, you both come from dairy background. Both come from dairy background. And with experience, particularly school resource officer lens, the drug information and intelligence officer lens. Also, you've dabbled in other things before related to law enforcement before assuming those roles. So maybe let's start with you, Sergeant Bethune. Can you please describe for us what types of prevention activities have you been engaged with as a law enforcement representative in a variety of different ways?
Sure. Good morning, everybody. Nice to see you all. There's obviously in law enforcement, for those of us in law enforcement, we always want to know the why as to why we do this and the end result. We want it to be gone. Unfortunately, a lot of times we have to sit back and know that this is something that's never going to really go away. As much as we fight, we can only prevent what we can. So in Douglas County, I've been very fortunate with my role. I've been over the SROs now for 3.5 years. I oversee 26 of them in 58 schools, along with 2 deputies that they do evidence-based teaching, which is our YES curriculum. And so we revamp that every single year, and we look at what is the needs of our community. And that's a big part. Is we know that there's not one type of prevention that's out there that's going to work for everyone. So by being in your own community, knowing what issues are in your communities, you are affecting your community. And that's where we have to start. We have to start in the community. And so I've also been fortunate to partner up with Skyridge Medical Center We have a coalition that's there, that's comprised of myself, a couple other chiefs in our area. We have South Metro Fire Department, as well as Capital Fire Department. We have the Douglas County Health Board is there as well. We meet 4 times a year. And it's ER staff ahead of the hospital. And I tell you, that's probably been the best group that I've been able to be a part of, because we are all at the table having a conversation as to what are we seeing right now. And then we can take that information. They can reach out to me, they can reach out to the other chiefs of police and the fire department, because there may be a situation where we don't see it in the school, but after school kids are going and doing THC, they're getting into harder drugs, they're getting into meth, and the fire departments are running these kids and to the hospitals, and the ER is treating them, but we don't really hear too much about it because we were kind of out of it at the time. So being able to take that information and put it into a working group in our schools is tremendous. So when I hear get people at the table, absolutely.
Thank you, Will.
So my experience is a little bit different. I was in law enforcement before I did this role. I worked for a lot of smaller rural agencies. So we didn't have SRO program. We didn't have formalized strategies for prevention. We had volunteers in their departments. The chief would be like, hey, we need something about the school. They would give us, I had a great friend and a great partner. Swiftly introduced me to this. We gave me a presentation. We got some great information about the laws, but I had nothing in there about the strategy. So that was my first exposure to this. Going in class, and I didn't realize when I got there to middle school, I was going to talk to every single class that they all day then. They would bring in a class every time, and every hour I'd give this presentation. That was my first exposure to prevention. I looked at a lot of the things our department was doing after that, and we started to change our approach to it, because primarily we were doing prevention through deterrence. We were being visible to mark units, mark officers in full uniform, physical at events when we had high protocols involving juveniles, wrong, one of the dance after a football game. And I said, are we trying to prevent something, or we're trying to pre-support the people? So we changed our approach to it. And we still didn't have a comprehensive strategy, but we took some of the things we found out, some of the partners, some of the bigger groups we called that give us policies. Start safety to instead of being a marked unit patrolling around the area, we had a uniform officer at the event. Something happened, we told the kids that we can help them resolve the issue instead of do something. So that was a little louder, better. But that was my first exposure. And now that I'm a drug intelligence officer for Montana, I work with all the public safety agencies in the state of Montana, and I work with friends who's our public health analyst. She works with our public health groups, and now we can see that getting people to the table, getting this collaboration going is very effective. One of the things in law enforcement is we lack resources and training for. And the public health side, we provide that. So that's kind of where one of the reasons I'm here is that's what I would like to change the focus for. But usually it's right now it's raising awareness in the area, using data, providing that to our law enforcement partners and our public health that are already working in prevention in their areas.
Thank you. I'm going to do an impromptu question for both police hearings. Just one, yeah, go ahead and hold the mic. So, just curious, are you both aware, considering the frame for this institute, are you both aware of the big picture and how what you're doing as a DIO, as a school resource officer, right? Are you aware of how that fits into the bigger picture for your communities? Can you talk about that?
I think as the DIO, as the drug intelligence officer, with drug response strategy, where I fit in with prevention, is the key part there is the collaboration. That collaboration between public health and public safety, because our team works with both sides, and we work together every single day. So we show that you can collaborate on these projects, that they do intersect. And then facilitating that collaboration, that's like the first step, but also sharing data. I didn't understand the importance of that until I got into this field. And I didn't understand how much data public health actually gathers, uses that to get that evidence-based strategy. When I did prevention with law enforcement, it's like, hey, we did this presentation, we were there, we had only one call for service, it's working. We didn't gather any information about who we talked to, what their gender was, or their age groups, or any, get a survey of feedback from them. We're like, hey, we have to arrest anybody, nobody went to jail, nobody got hurt, nobody crashed. Great job, guys. But in the long term, I didn't see how effective that collaboration can show actual feedback that you're making a change. You need to change this. Because in law enforcement, if it ain't broke, we ain't gonna fix it. If we think it's working, we're gonna keep doing it. So I think as the DIO, the main part of my job is to start that collaboration. Go to events like this, take that. What are the evidence-based strategies? What are people doing? What is working? I don't steal those ideas, but I actually bring people up in Montana with like they want to do something, gives us our programs. We're getting direct contact. I'm going to help facilitate meetings and show them, share those policies, help them implement that. That's the main role of the DIO.
So you're serving as a connector to the information. So while you may not be looking directly at where we're headed, right, out from the substance use prevention, you are pretty clear in the role that you're serving indirectly to help bring those evidence-based strategies forward towards the outcome. And you're facilitating those connections.
Yeah, I would agree with that. And then one thing I forgot to mention is like one of the things I try to do a lot is assessments. What's going on in our state and in our communities, and providing that information to people on the ground that don't necessarily have access to that. Because one of the things, Montana is a very large state. We are very rural, but rural populations have a very large area cover, not very many people that lack resources. So one of the things we're trying to do is target prevention efforts based off of resources in that area towards the greatest threat at the time. So we're getting part of the bang from we're trying to make what we have. Then in the old days, that was just like, well, what do we need, chief? What do we need, sheriff? What's going on in the area? Now we're basing that off of data. We're basing that off of information that's being gathered by public health partners and law enforcement. We're sharing that data and we're looking at it and doing analysis of it, which is it's amazing.
Thank you. Dr. McKinney?
So, yeah, that's always a great question as to where do we go and how do we get there? And, you know, if it's not broke, we're not going to fix it kind of thing. And, you know, law enforcement has typically been when we get a call, we'll go. It's always been that we're there if you have a problem, call us, we'll come help you get through it. But a lot of what we're doing now in schools is, having full-time SROs that have been in schools that are building those connections. We have them down into elementaries now where that's the first positive connection that kids are having with someone in uniform. And it's a big deal. We're not there to get them in trouble. I know there's a lot of people that think, oh, law enforcement, if they show up, they're going to take you to jail or they're going to, take your parents to jail or anything like that. And we make it very clear, especially when we're walking around, high-fiving kids every week. We actually go out, we pick an elementary and 5 of us show up and hand out stickers to every single student and bring them at the door. How are you guys today? And we rotate throughout the county. now 36 elementaries. It takes a while, but we do that in every elementary. And I think the big part is going back to data. We know the data in our own world. When we get a phone call, the address is flagged. When we run someone, they're flagged in our system that we cleared them, make sure that they don't have any warrants or anything like that. And then if we need to do a report, the report's there for us to look at a later day. But when it comes down to information, being with the health department, they are gathering all this information, and we need to start looking at, instead of recreate the wheel, let's get on the wagon. Let's just keep going. And I think that's the big part of us in law enforcement, and especially with, in the schools, we get the attention of kids while they're at school. They don't have an outside factor as we're standing there talking to them. But, law enforcement, we need to be better at, after school events. I think all of my SROs, they attend a minimum of 6 events every year. Whether that's the proms, the homecoming, the dances, sporting events, and half of the SROs actually coach a sport or two. And so they're getting to see those kids after, and we need to continue that. And I think that's where, another working relationship can come into play, where, kids are done after school. Where do they go? They go to after school, whether it's, a community based, whether, at the school or anything like that. We need to get in and say hi to kids and be that familiar face to them. So, they're not scared when we come in to talk about what's going on. They can actually hear us instead of seeing a badge, seeing a uniform, and going, oh my gosh, the last time I saw you, you took my parents out in handcuffs. What are you here for? That's, I've talked to kids like that. And when they're like, hey, I actually got to hear the presentation, hear the evidence-based material, how bad this truly is, versus you standing up there and me thinking, oh, I'm at home. So I think just that's where we started our foundation. We start going.
Something you said in one of our earlier conversations really struck me. I think Zoe, I think you may have been on that call as well. But you said that as a school resource officer, essentially you're integrated into that microsystem. And it is a microsystem all on its own, right? But the way that you interface with the youth is much different than the way the educators interface with you. You may be called to support another type of law enforcement related issue with the youth, right? So you're exploring that dynamic with them, and you have a different type of understanding. But also through attending these trainings, you mentioned that you also, as part of that team, as part of that microsystem there in the school, you're able to bring the evidence-based strategies and offer ideas to the school unit, which may not, always have the time either to go to these types of trainings or really understand, the various levels of strategies available to them.
Yeah, I mean, that's exactly it. I mean, we get to go to certain trainings that educators don't get to. We get different, philosophies, and we see different things through a different lens. My wife is a teacher, so she sees things completely different than I do. Works out quite well. But it's one of those when we get to bring things in and talk to educators, and then we also have people who on our state board who we have an advisor that is a principal, that is an educator, so we can bring things to those people and say, hey, here's what we're thinking, here's what, we just heard this is a great idea, and they can start working with that, and we can start building curriculum around that. It's just, it just brings in a whole new level, and we continue to build upon.
Thank you. Absolutely, Bill.
At one point, I wanted to make what you just. Oh. All right. Okay. I think it's important because one of the things that you're going to be hearing from Chris Boswell tomorrow about school, one of the things that she and I are talking about is building community coalitions within the school environment, so that we have integrating all people involved, students, law enforcement, faculty, parents, etc., to look at the school environment, because we're the strong predictors outcome, positive outcomes for schools is creating a positive environment, school environment. And she'll be talking more about that. And I see a team being built, sort of like the community college, but in the school. And that's sort of what you're sort of addressing, but not, it's not happening.
Thank you, Billy. Feedback, okay. Because I don't want to run out of time and miss this question. We're going to challenge you to think innovatively, and I did prep them with this, so they've had an opportunity to brainstorm over this, but you know, this is an evolving field. We're still kind of learning and characterizing what is currently happening, right? Related to how law enforcement in their unique communities are engaging in ways that make sense for them, right? You've just shared a few examples of how you have been a part of that, right? But if you had to just think broadly, if you had to be innovative, if you had to like paint a future for maybe some things that could be tried, right? Or maybe some things that you've been pondering over, right? In terms of, I see an opportunity here with public health and public safety, or I see an opportunity in the school in terms of my role as an SRO, or just opportunities in the community with environmental strategies. If you had to just kind of describe for us what's in your mind, what's going on up there in terms of, I've wondered about this and I can see a future for this. But what would that look like?
I think, and I'm kind of biased on this one, but the integration, collaboration, in public health policy at the local level, in my opinion, have the most effective response. Because they're the ones that are invested in the community, and they're the ones that make decisions. But the first conversation that I went to have is like, I see this all the time, and I was this way when I started this job. I didn't understand what my partners in public health were doing. As a law enforcement officer, I understood exactly what my job was, my responsibilities were, and when I had something process with public health, I knew what they were going to do in those scenarios. That was it. I think starting a conversation, understanding what that we had a shared goal, and identifying that goal is the first part, and then the importance of evidence-based strategies for your response at the local level starts with sharing that data, sharing information, seeing what strategies are going to fit your needs. And one is the collaboration and the communication plan have to be ongoing, constant. Especially in our rural communities, our rural areas, we have turnover, we have a lot of leaving the field. So you have to have an effective communication plan that somebody can pick up and take that and keep moving that along. Because a lot of times what I see with all of our efforts is the person that was invested in that role, or making great strides to it, takes a different position or leaves the field, and we lose all of it. So we don't document what we're doing. So I think if it was my ideal, when we start with our collaboration, understand what our partners are doing, how they're doing it, what our joint goal is, what each person brings to the table. Because as a law enforcement officer, I had a limited amount of things I could do by law and by resources. And I don't think we have enough collaboration where we can do a handoff, one handoff to the public health partner to address an issue that maybe I didn't need to take an enforcement action on, but I had to take an enforcement action on because that was the only thing, that was the only tool in my tool belt at that time. So I think if we expand that role.
Wow, can you say that one more time? That was really essential. Say that one more time. That's a nuance that has not been fully addressed yet.
Just having that additional resource for law enforcement so we don't have to take enforcement. There are a lot of times where I had to take an enforcement action for the health and well-being of a child that I didn't necessarily want to take, and I didn't have to necessarily by law, but there was no other tool, there was no other resource. So for the safety and well-being of that child, I had to take them into custody Because at least I knew if I took them into custody of what they had done, then I knew they were gonna go to a safety like. Because I had no other way to, I had no other option, I had no partner to reach out to that resource. And that's where our public health partners underutilized. Because I had no idea what they were doing. I had no idea who I could contact on this. And then later on, they came to me, they were upset. They were like, hey, you did this. And I'm like, yeah, I had no choice.
You were honing in on really. Collaboration can be a very vague term that is thrown around a lot, right? But when you really bring it to life, and I think what you're getting at, and I just want to clarify, please tell me if this is correct, is that we need to spend a little more time and be more intentional on what does that relationship look like to then accomplish the comprehensive strategy in that community. And without a strategy, right, you're going to have your set of tools. Public health will have its set of tools, right? But you just described an area in between where if you were aware, if you had even just a relationship with them and could explore, have a conversation around, I don't want to do this. These are the tools I have. What do you think? That really could change things for you.
I think it changed everything. Understanding, I think the biggest takeaway I've had since I've been in my role as a drug intelligence officer is that we all in public health and public safety want to address the issue. We all want to work towards making things better for our communities. And that everyone has a role in that approach. I think the thing we've had is that we focus too much on, well, I disagree on your role, I disagree on this part, instead of integrating those roles, showing that they do line up and that every person has a role to play. And that's huge.
How do we work together for effective prevention through this comprehensive strategy? Thank you, Will. Sergeant Methuen, how would you answer that?
Same, no, it's. Will's absolutely right on in terms of we've got to get, because what we do in Douglas County is not going to work for Weld County. It's not going to work for Boulder. But there's certain things that we can do that will help all communities, because we all know that there's a drug issue in the state. Everyone sees it. And now that we're finally at tables having conversations saying, how can we do this? We need to focus on the communities, but we need to have those resources out there. We noticed a few years ago that our mental health in the community was driving crime high because, we had a lot more people showing up with mental illness, especially when COVID. We all know what that took on everyone. And so we created a crisis response team within the county where we now have 8 deputies and 8 clinicians that ride together, to where us taking people to the hospital, giving them a hospital bill, taking them out an hour later, saying, hey, call someone, that does nothing. We now have clinicians, and that we've used the health department as well to give all these resources to people, where we're not overloading the hospitals and people are actually getting true help. And I think we take that approach and we start looking at that and dissecting how can we do that in everyone. And it starts with that evidence-based, looking at the numbers, and we got those numbers from the health department. They said, hey, you guys have a lot of people going to hospitals. And then they're kicking them straight out and they're not getting true help. How can we better that? And I think that starts, this conversation here as well with substance and drugs. Is we know there's an issue. Let's start working on it. How do we not just take someone and say, hey, you're going to, you're getting criminally charged, but how can we prevent that?
Yeah, and since you are our school representative as well, right? You're the school resource officer, I'm gonna put a shameless plug in for social norms, right? Because you just mentioned a lot of examples and disabilities, right? Related to maybe that other end of the prevention continuum. But if you're there and present in the school, you're part of that microsystem, part of that team, you have an opportunity to also reinforce the positive through norms that the majority are not using. you know, and really bring that to life through that evidence-based intervention as part of that school communications. So, good, okay, Patty. 13 minutes left of the whole session. Okay, so do we have any Q&A that we would like to go?
Yes, so I will start with the Q&A that's coming in from the Zoom. And then also, this is a great opportunity for those who are in seats to sort of raise your hand. We'll come around and you can answer, we'll ask your questions as well. But just to start, there was one question that came in specifically around, well, first applauding, the outreach efforts that are being done in the community and ways of engaging with you within the communities. There was a question about how the approach might look different depending upon the type of community, and in particular, potentially marginalized communities or communities representing folks from sort of BIPOC backgrounds, Black, Indigenous, and people of color.
I think that goes back to talking to the youth when, you know, at the earliest that we can, getting in and talking to them after school events, you know, organizations. I keep looking over and Boys and Girls Clubs sitting over here, so I noticed them right away. You know, their logo is very, you know, can tell. But I think for law enforcement in those communities, it needs to be not just, oh, we'll get there when we can. It needs to be a directive of, you need to get in, you need to talk to kids, you need to talk to the youth, and that's a great spot for them. They're in a safe place, they're not in trouble, and having that relationship that you can go in and be like, I'm here to play some basketball. Let's play a quick game of, you know, whatever. When we get a chance to go out and, you know, kids are playing kickball, we just played a unified kickball team, and, you know, one of our schools. It was probably a bigger event than the basketball team draws, because there's kids lining the field, you know, that they get to see a bunch of cops run around and play kickball. I mean, how fun is that? So I think that just has to be part of it.
Our team does a lot of work with our Indigenous community in Montana. We have 8, well, soon we'll have 8 reservations. Each one's different, and they all have a different relationship with state and federal entities. I work with the state of Montana, and I work for Al-Qaeda. So when I went into this community when I first started, I didn't know anyone. I had a work relationship with everyone there. I was very open and transparent as to why I was there, but instead of going there with an agenda, I want to implement this, I want data from this. I went there with the same assessment I would do with any other community. Then I said, these are the resources I have. And then I asked, what do you need? And I tried to fill those gaps, fill that hole. And it takes a lot of hard work and transparency. I will say you have to be very transparent when you go into these communities as to what you're doing, why you're doing it. You have to have collaboration. You have to work with your partners that are already there, that are already doing work there. That's how you get into this to start effective, in my opinion.
And to piggyback on Will's very beautiful example of that, when you go and you just offer, you know, here's what I have, right, in terms of evidence-based strategy. Later in the Institute, you will be hearing about ways to adapt those strategies carefully, thoughtfully, process for doing that. So that will inform the approach for adapting any evidence-based strategy for a specific population.
Thank you. The next one actually is a comment. So Fremont County, Wyoming is very proud and fortunate to have their law enforcement agencies, ranging from the Sheriff's Department, the various police departments, and Highway Patrol, all working together to collaborate in very highly engaged in prevention efforts. So I just thought I'd share that board as another resource for folks who are looking for a county to perhaps look to and reach out to for ideas. And that was Fremont County, Wyoming. And we're all done with the online questions. So audience, our live audience, what questions do you have for people? Panel, you may need to repeat this question so that the virtual audience can hear.
So I was just wondering what it would look like for as you guys work like as like SROs and that with kids that are already in the system. That like as far as like dealing with maybe that are what they call conversion schools, have you guys dealt with that kind of thing, so like that, and as well as like that are in the like community corrections or whatever system and stuff like that. You guys kind of deal with like as SROs deal with that kind of stuff too, like you work in like with different like more places where kids might be doing like their community service like that.
So when it comes to like, oh, sorry, I'll try to repeat it as best I can. SRO is working in, juvenile corrections facilities, as well as alternative schools. I can tell you corrections facilities, typically SROs don't go in. They've got their own officers that are there. And they've also got their own staff that are there. And I would hope that those staff members are also kind of hearing what we do in terms of the SRO side of it, to be mentors and counselors for those kids. And I think they do a really good job in that. As part of the alternative schools, yes, we have not only effective needs programs in schools, but also standalone schools that are the effective needs schools, and we have SROs that are specific to those schools. And it's when it first happened and we first were able to get in those schools, there's a lot of pushback from the kids. Parents kind of were hands off at that point, but the kids didn't want to see us there because they thought they were going to get in trouble. But I can tell you, just yesterday walking into that school, I get to go in every so often as a supervisor to make sure everything's going well. But the ones that I've walked into, you actually get to sit down and have a conversation with the kid. You're sitting across from them or sitting there talking, hey, this kid is having a bad day. And we get to go in and kind of take off the uniform as best we can in terms of having a conversation with the kids. So yeah, it's we're in those schools. We work well with those kids, and we've actually been able to use some resources that we've been able to have in terms of from the community, people that we know, businesses, and we've actually partnered with those businesses and the kids that need community service hours actually go and work and help out those communities. And it's a partnership. It's kind of a thing that we have to kind of vet and be careful of what we're going to do for what the kids, but it really gives meaning to those kids who really the only structure in their life is at school, and we get to help give more structure outside. And we find when kids have structure, whether it's sports, after school events, they're not out in the community stealing cars, breaking windows, and doing drugs. They're engaged with their peers. So we try to build on that.
Similarly, a lot of teachers in schools will respond to these discussions saying, well, that's not. I already thought. Likewise, what would you suggest we have to talk about the fight help them kind of balance it?
So, a teacher saying it's not their job, they already do so much. Law enforcement saying the same thing. I say it's hard work. Anything that we need to get through in this community and in life is hard. Being able to sit back and just do someone else's idea and just buzz through. I say you need to challenge those people and say, hey, here's the issue that we have at hand. I understand your job is to educate, your job is to teach, my job is to enforce the law, but we need to work together. We're a partnership. And I think that's really where having someone in the schools already to where they can have those conversations, not in front of a class, at lunch with the teacher or whatnot, and say, all right, I hear that you're busy. I know you have X amount of hours that you need to meet for the state. I'm here, every day. How can we build this partnership? Let's challenge each other. You challenge me, I'll come in and, we'll talk about this topic. Or, I've had, people call and say, hey, we're talking about law. Can you come in and talk about, your funniest and scariest moments in law enforcement? And, tell people about, a silly situation that you had to go through because it was someone's crisis, but everyone else thinks it's silly. It really makes them connect with you. And I would say that's just the biggest thing that I've been able to work with people in the schools is let's challenge. It's not easy, but let's get together.
And I might just add to that, Miles. Every community is different. Every school is different. Every leadership team at the schools is different, right? And just being able to not only ask the question about where do I fit in, but where do you think I fit in to that structure, right? Because what works really well for one school might not work as well for another because they've got additional need. They have all the staff they need, right? Related to educators or administrators, or maybe they're even bringing in, we work with a lot of schools that bring in coalitions, right? As formal community partners to support that, and law enforcement are at the table, but then they serve a slightly different role, right? Depending upon what the needs are for that school. So yeah, having the conversation around not only where do I fit in, but what do you think I needed here, and then pursuing what they come up with.
There was an online question that just came in that also taps something similar, but the question is somewhat flipped. In a community where there may not be an SRO, how would you go about gaining support of the sheriff's department to pursue some type of an SRO prevention collaboration in a way that really highlights the importance and the possibilities of that collaboration and how important it can be to others?
Every department I've ever worked for has never had an SRO position.
So the question,
Yeah, my question is, how do you engage with the sheriff's office that doesn't necessarily have an SRO position to highlight the need of that and to get them to collaborate to address the issue? Like I was saying, every department I've worked for, we've never had an SRO. I worked at a 3-man sheriff's office. The last one I just left, we had 8 sworn officers, including the sheriff manager. So talk to the deputies or the officers and find out which one is interested in this work. Because I guarantee you, one of them wants to be an SRO. One of them wants to do that. There's always somebody in the department that has an idea of like, hey, I want to work with kids. I want to do this. Because that's your partner in that department. Then if you want an SRO, actual formalized SRO position for the sheriff's office, find your candidate within the department who wants to do it. Then you have to look at collaborative funding for a position or grants. Because sheriff's offices, limited amounts of budgets, these departments have limited budgets. So if you're going to go in and ask them to take on another task, another role, take an officer out of a role they're already doing, you have to give them a way to fund it. And then show them the need. Bring it up to the sheriff or the undersheriff or the chief and show them the data and the statistics. Then show them the community support for it. If you can show leader in law enforcement this is something that they need, the community wants it, and the community leaders and community members are going to support it, they're going to work to get that position. You just go in off the street and say, hey, I think we need an SRO. Yeah, they're going to tell you where the parking lot is. But if you do your research and you have this stuff available to them, then the answer is a lot different.
thank you, Will. And I'm feeling a nudge to also be a light for our main messages around comprehensive community strategy can be your starting point. And those conversations you mentioned demonstrating that there's support for it, right? Those conversations may not necessarily have to just happen at the law enforcement level, right? And the engaging interest is so critical and important, right? But maybe the conversation is happening with those champions for the community strategy, so that conversation does unite around where you guys are headed and how law enforcement can play a more a more engaged role in the schools, right? If that makes sense for those champions, right? And law enforcement is one of those champions that would be part of that conversation.
And that was all. That actually,
I'd like to just maybe last word here. My background, I apologize, it was really epidemiology, that's also very, thank you. So data, and it pleased me so much. You're mentioning that because I see that working with the clinicians I work with. They're shocked when they see the ages of kids coming into the emergency room, like with drug overdose. We just looked at a report last week. And we had 9 cases of kids under 16, including 2 4-year-olds. And overdose. Once they see that, they're shocked and say, well, what can we do about it, right? So it's not just that kind of data, but emergency data. I think data's really important. And we're gonna be, and that's my, and what that's my, I'll be talking about is the resource assessments of communities. Later today. So that, that there's a variety of different data that you can use, those that are out there already as well. So,
There's a variety of data, there are a variety of paths that could be chosen, right? And so collectively, if you rally around that comprehensive strategy, you can choose a path that will lead you towards effective prevention.